Hi, I'm Ilana Reisman, and today's presentation is going to be about autism in female patients. Most of us heard a few things about the autism spectrum disorder. As we know, it's a developmental disability. Also, most of us know the main symptoms that patients can show. I'm quite sure that most of you know these following symptoms that we see here. The high interest and knowledge in specific topics, repetitive behaviors, challenges with social communication, and lack of eye contact. That's a classic one. But what most of us don't know is that these symptoms represent male patients. All of these symptoms above, as you can see, it's written on the PowerPoint, you can see that they represent mostly male patients. Female do show high interest or knowledge in specific topics, but it's mostly dismissed by doctors or parents because it's girly topics. Girls, they like to show high interest or knowledge in horses, in dolls. It's something that is thought of as something very common and regular, normal. Sadly, because of these very known and specific symptoms being male symptoms mostly, female are very likely to be misdiagnosed because of that, or undiagnosed at all. According to studies, it is known that there are among us hundreds of thousands of women that are being either undiagnosed or misdiagnosed. It's crazy numbers. And the only reason that they're misdiagnosed or undiagnosed is that they do not fit in the male phenotype. The fact that not everybody knows is that most research, old medical research done, it was done only using male patients. So they got male phenotypes. Like nowadays, we all know that a woman coming to the ER can present very different symptoms when she's having a heart attack comparing to a male. So until today, even when it's known, they're very likely to be to get late diagnosed, and they have higher risk of dying from the heart attack. So these numbers are showing us that at least we are getting a little bit better recognizing that female patients don't have to fit in the male frames. When they just started researching about autism, it was a male-only disease. Then it turned 30 years ago to 1 female for every 10 male. After that, until a few years ago, it was 4 to 1. And now studies are showing that the numbers are as low as 2 to 1. A very, very sad part of it is that they're not all of them are being just undiagnosed. Some of them misdiagnosing are critical, like anorexia. A study done 2 years ago found these disturbing numbers as high as 23% of women that are hospitalized with, like, under the diagnosis of anorexia. They all fit in the criteria for autism. Now, if the anorexia is a symptom of autism and it's not the main disease, you would definitely treat it differently. So they're also not getting the appropriate medical care they need. Now, this next slide can show you very common symptoms for ASD in female patients. Eating disorders, depression, social anxiety, low self-esteem, all of them can be their own diseases, can be their own conditions that are treated differently. But here, they're just a bunch of symptoms that can help us diagnose a patient with autism. Sadly, most of these symptoms are also known as mental diseases, and they affect the mind and the body, and not treating them appropriately, and women just wandering around the world and thinking, what is wrong with me? Why don't I fit in? Why am I different? Being depressed without getting the appropriate treatment, it can end up very bad. Undiagnosed females with ASD have a survival rate of 40 years old due to suicide. Now, if we would have treated it appropriately, maybe it could be prevented. The rate of survival in male patients are almost as normal as healthy people. Now, what can we do in order to change it? How can we make these horrific, bizarre numbers better? One of the ways, and the best way, is knowledge. The first person to see that girl with autism wouldn't be the psychiatrist. A brilliant psychiatrist that is very highly updated with all the new information of the female phenotype. It most likely won't be him, but it would be the teachers, the parents, the physicians. These are the people that help diagnose, send them to investigate and try to figure out what is wrong. These are the people. These are the first aids. They can save lives. So if we increase the knowledge among them, and if we're capable to make them understand that female phenotype has different criteria, and make it as mainstream as not being able to keep eye, it changes lives. Thank you for watching me.